Okay, I'm going to convene us, everybody. Good afternoon or good morning, depending on where you are in the world. My name is Sandro Galea, and I have the privilege of serving as Dean of the Boston University School of Public Health. And on behalf of our school, welcome. Before we begin, a word of thanks to all who helped make today happen, in particular to our event co-hosts, the Milken Institute School of Public Health at the George Washington University and the Lancet. Thank you as well to our program co-lead, Dr. Adnan Haider, Senior Associate Dean for Research and Professor of Global Health at the Milken Institute School of Public Health, from whom you will hear shortly. Thank you to Meredith Brown and Alicia Noel, who made this event possible. In 2017, there were about 39,000 gun deaths in the US. This is an increase over the previous year and has been accompanied by a tremendous and long overdue increase in attention paid to the issue of guns in the US. However, the US gun deaths are part of a larger picture. Guns kill at least 250,000 people globally each year. As you'll hear, this is probably an underestimate. This does not even count the scores of non-fatal injuries caused by guns or the mental health burden of trauma due to guns. Despite this burden, the global conversation around guns and gun-related injury lags behind. We have yet to begin a full conversation on the political, cultural, and economic drivers of gun violence. Doing so is difficult, as we in the US well know. Yet, recent months have shown that we can change the world in fundamental ways when we feel health is at stake. We have seen significant shifts in the conversation on guns in countries like Canada and Australia emerging. This change starts with choosing not to accept that death and injury due to guns is inevitable. Choosing this starts with having the necessary, at times uncomfortable conversations about guns and their contribution to poor health worldwide. Today, we are very lucky to have an expert panel to lead just such a conversation. Our goal today is simple. It's to educate our thinking, to contribute to a growing global conversation about guns, a conversation that can lead to an improvement in health worldwide. I'll now move to our panel. The plan is for each of our panelists to speak for about 10-15 minutes, and then Dr. Haider will moderate questions from the audience. Please feel free to use the question tab in your Zoom browser, and we'll do our best to get to as many questions as we can. Before we begin, a particular note to our panelists who are calling in from all over the world at all hours of the day and night. Thank you to all our panelists, and thank you to all of you who are joining us here today for this conversation. Our first speaker is Philip Alpers, Associate Professor at the University of Sydney and Founding Director of gunpolicy.org. Philip, over to you. You're on mute, Philip.
Thank you, Sandro, and greetings from Sydney, Australia, where it's recently was 4 a.m. Let's start with some raw facts. According to the Geneva-based Small Arms Survey, there are more than 1 billion firearms in the world, and 86% of those are in the hands of civilians. Each year, about 8 million new firearms, plus 10 to 15 billion rounds of ammunition are manufactured. That's enough bullets to shoot every person in the world, not once, but twice. Most firearms and ammunition are in the United States. America has less than 5% of the world's population, and yet its citizens hold about 50% of the world's guns. Sorry, I'm going to have to get rid of a screen here because it's popped up full screen. There we go. So, as I said, most firearms and ammunition are in the United States. America has less than 5% of the world's population, and yet its citizens hold about 50% of the world's guns. For sheer numbers, no other nation comes close. Likewise, the rate of civilian firearm ownership per 100,000 population is highest in the United States. The next closest country is Yemen, followed by Switzerland, whose standing army includes most of its adult population. United Kingdom and Japan are way down to the right. And the most serious effects of all these firearms? Well, the most recent peer-reviewed study of global gun deaths, published in JAMA, estimates that 250,000 people died by gunshot in 2016. That figure is almost sure to be conservative. In the total number of gun deaths, that is all firearm-related mortality regardless of motivation, the United States does not lead. Brazil has 1/3 fewer people, but reports many more deaths by gunshot. Perhaps more meaningful is the rate of all gun deaths per 100,000 population. Here, Brazil surpasses the US by a higher margin, while South Africa also creeps in. But now we're forced to swap criteria. In high-income countries, the total number of gun deaths is known, but for many middle and lower-income countries, we just don't have the data. So to compare all countries, the most reliable global indicator is gun homicide. By the numbers, Brazil is ahead by a wider margin. To the right, many of the world's wealthier countries remain low in comparison. But then when we chart all the countries with the highest rates of gun homicide around the world, we see this. Where is the United States? Well, that's the bright red bar third from the right. America is now the only wealthy country on this chart. As you can see, globally, the countries most affected by gun violence are in Latin America, the Caribbean, and Southern Africa, plus the Philippines. Rebecca Peters will talk more about this in a moment, but first here's a chart which some people find surprising. For nearly half a century in the United States, interviewers in America's General Social Survey and others have asked the question, do you have a gun in your home? For the first 37 years, the answers showed a downward trend, that is, until the Obama and Trump administrations. So what's happening here? Well, for decades, the Americans who bought more firearms were by and large the same Americans who already had firearms. Those who owned guns were buying more, while those who owned no guns were becoming more numerous. But lately, the proportion of US households with a gun has been trending back upwards. So enough charts for now. We all know how and why America chose to tread its unique path with regard to firearms, but this wasn't the only cause of the country's global exceptionalism in gun control. More than a century ago, the dominant European and Asian empires moved in exactly the opposite direction. Their cities were beset with street violence, and some of the criminals, anarchists and Bolsheviks, had guns. In London, 3 policemen and a Latvian revolutionary died in the Sydney Street siege of 1911. That's Home Secretary Winston Churchill wearing a top hat, having his picture taken at the scene of the shooting. British police, routinely unarmed, even to this day, had to summon the Scots Guards to bring some guns to the gunfight. Highlighted in the middle of the photo, there's Churchill again. And so it was that in the early 1900s, the great empires of Europe and Asia invoked public shootings as a reason for all to agree on 3 central pillars of gun control. Those are the person, license all gun owners; the object, register all firearms; the right, defined in legislation as a conditional privilege. Now, by making gun ownership conditional on reasonable need and good behavior, the third of these pillars explains why no other country on earth has a Second Amendment. Because the great empires were just that, these European and Asian gun control laws were copied to about 150 colonies right around the globe. Although it's these colonial-era pillars of law which enable most governments to keep a handle on the misuse of firearms, an even more potent force has recently changed the face of gun control. For many decades, injury by gunshot was seen almost exclusively as a crime problem. Most of the proposed solutions fell into the bottom of the cliff variety, that is, after the fact, law enforcement and retribution. But to public health practitioners, the gun is to gun violence as the mosquito is to malaria. Bullets and firearms are the agents of harm, and both are amenable to standard injury prevention procedures. So instead of waiting until after the damage was done, advanced societies developed a range of well-proven harm prevention measures, just as they did for the toll of automobile injury, tobacco-related disease, HIV/AIDS, smallpox, and many others. So here's the thing. Americans have already invented, tested, and proved most of the solutions we need to control this epidemic. On your roads, you deployed a holistic array of evidence-based public health measures to dramatically reverse the toll of death and injury by automobile. The world followed suit, and we will always be grateful for that example. It took safer cars, safer roads, drink driving laws, traffic calming, but also the three pillars of automobile control. That is, the person, license all drivers; the object, register all vehicles; and the right, defined in legislation as a conditional privilege. Now, licensing and registration of vehicles did not lead to mass confiscation. Abuse, sure, it's true, abuse the privilege of motorized mobility and you lose your license. Yet cars remain unchanged as symbols of masculinity, power, and freedom. Public safety campaigns, from tobacco harm reduction to HIV/AIDS, smallpox, malaria, Ebola, saved countless millions of lives. The same is being done today with COVID-19. In each case, America's public health and legal communities overcame the denial of cashed-up self-interest groups, and the world followed your example. With HIV/AIDS, you even set aside religious objections, which were then just as potent as the so-called God-given right to bear arms. But realistically, licensing gun owners and registering their weapons, that's just a bridge too far, right? Well, not for Franklin Roosevelt. The St. Valentine's Day Massacre prompted your National Firearms Act of 1934 to license all owners of machine guns, silencers, sawn-off shotguns, and rifles, and to register their weapons. 86 years later, the NFA remains US federal law, and machine guns and sawn-off long guns are still the weapons least used in armed violence. In Hawaii, Connecticut, Massachusetts, you've already shown us that licensing and registration can help to curb gun violence. But again, realistically, it's just too big a job, right? Please, the entire European community registers every cow. India has a population of 1.4 billion, yet 80% of households in India register the LPG bottles that they rely on for cooking. We know how to do these things. Now, I don't suggest for a moment that you can just repeat what other countries have done. In Australia, Conservative Prime Minister John Howard wore a bulletproof vest as he faced the rump of his support, rural gun owners, as he told them to surrender most of their semi-automatic long guns. To match the Howard government's buyback and destruction ratio, America would have to destroy 90 million firearms. The United Kingdom first prohibited and then purchased and destroyed almost every private handgun. Brazil and Argentina followed with their own large-scale gun buybacks and weapons. Canada will now do the same with so-called assault weapons. All of this is confiscation of private property under threat of a prison term. And I know that's not the American way. But now, even retired justices of the Supreme Court have mentioned the heretical truth. The Second Amendment is just an amendment. Americans are free to introduce or to repeal a constitutional amendment, just as you did to expand suffrage to all citizens, to end slavery, and to introduce and to repeal prohibition. Given the frequency and scale of firearm-related human rights violations in America, with no turning point in sight, such a step to curb armed violence should at least not remain unattempted. And surely it must never be considered unmentionable. Now, I'll be stunned if this happens in my lifetime, but I am confident that our grandchildren and children will see the day. Thank you and good luck.
Thank you very much, Philip. That was terrific. Next up is going to be Natalie Goldring. Natalie.
Good afternoon. Thank you so much for having me today. And I'm speaking on behalf of IANSA, the International Action Network on Small Arms. And it's a pleasure to be here. This is important work and it needs to be heard and seen more broadly. The work I'm presenting today is part of the initial findings of a project that IANSA is doing with the UN Office for Disarmament Affairs under the sponsorship of the European Union. And the intent is to help address global gun violence by focusing on gender and small arms. Next slide, please. And gun violence is not a simple issue. The causes have legal, political, social, military, and economic dimensions, and the effects are present at local, national, regional, and global levels. Taken together, the solutions have to address these varied dimensions and their effects. Next slide, please. Complex problems don't tend to be susceptible to simple solutions. And I find it ironic that Philip and I are both talking about auto safety. I find it a very useful way of looking at multidimensional approaches to problems and ways in which they can be successful. Next slide, please. Here in the United States, the death rate is less than 30% of what it was in 1972. In 1972, we lost about 56,000 people on the roads. In 2018, we lost about 39,000. So despite driving more than 2.5 times as many miles per year as we were in 1972, we're losing many, many fewer people. And as Philip said, this is because of a constellation of measures. It's not one single factor. It's seatbelts, it's airbags, it's improving the integrity of the passenger compartment. It's adopting and then enforcing the penalties for people who drive impaired or drunk. And it's implementing crash avoidance systems. Taken together, these passive and active measures have made an enormous difference in public safety. The same can be true with gun violence. Next slide, please. Here too, global gun violence is a very good parallel, and it has to be addressed at multiple levels. IANSA works on numerous issues related to reducing gun violence, from focusing on gender-based action, which I'll talk about today, talking about ways that we can use different instruments together to enhance their effectiveness, looking at controlling access to ammunition far, far better than we do today, destroying the excessive accumulations of small arms and light weapons, and the weapons that are left over when conflicts end, rather than letting them simply be circulated into other conflicts. Addressing armed violence and crime as well as conflict. Most of these deaths are occurring in crime situations, not in conflict situations. And looking at the links between reducing small arms and light weapons and development. Next slide, please. And this is just a first cut at the question of gun violence as a gendered phenomenon. We see differences in terms of who is likely to commit the crime and who is likely to be the victim, where the violence is likely to take place, and what the role of the violence is likely to be for personal causes versus for money or property. Next slide, please. And here we see an example of ways in which the risk of violent death increases for everyone when there's a gun in the home, but it increases significantly more for women. So other ways in which gun violence is a gendered phenomenon. Next slide, please. We see the destruction of essential services, and that disproportionately affects women because they're the main users of these services. The burden of care falls disproportionately on women when family members are injured or killed by guns, and the policies are overwhelmingly made by men, generally without consulting women. We see the pictures over and over of political leaders in rooms filled with generally white men in black suits. And even when women are in the room, it's very hard for our voices to be heard and for our perspectives to be heard as well. Next slide, please. In terms of global efforts to address these problems, there are two main instruments that people are working on today. The first is, we call it the Program of Action. Its formal name is the Program of Action to Control the Illicit Trade in Small Arms and Light Weapons in all its aspects. Now you know why we abbreviate it. And the second one is the Arms Trade Treaty. Next slide, please. The Program of Action is a political commitment to work to prevent the illicit, the illegal trade in small arms and light weapons. But of course, since most of these weapons start their lives as legal weapons, you do need to have some idea of what's being manufactured and what's being shipped and transported in order to figure out what the illegal trade actually is. And the entire world endorsed this program of action in 2001, actually just before the 9/11 attacks. And it's an attempt to, next slide, work at all levels, at national levels, at regional levels, and at global levels to stem this problem and to work on these excessive and destabilizing accumulations of weapons by better controlling them, by having stockpile security measures, and as we advocate, to destroy them so that they can't recirculate, and to increase public attention to these issues as a means of increasing political will to do something about this. On the other side, we have people who have a very strong profit motive. And so it's not an easy fight, but it's an important one. Next slide, please. Unfortunately, in 2001, the program of action did not cover all issues. And some of the issues on this list were very, very hard fought ones. We won on a number of issues, not on these. So not only was gender-based violence not included in the program of action, the word gender did not appear in the program of action. And to the extent that women were mentioned, it was in the context of women and children as victims. Fortunately, things have changed since that time. Next slide. The Arms Trade Treaty, which entered into force 13 years later, is an important complement in the sense that it strengthens some of the provisions and information or requirements, political requirements in the program of action, but it also has new requirements. It's legally binding, not just politically binding. It actually sets standards with respect to human rights, and it requires that one of the considerations when deciding on weapons transfers be the risk of gender-based violence. Next slide. So what we see in the UN context is we see increased attention to these issues and attention beyond simply the issue of counting the number of women in delegations. And in the most recent conference on the program of action, countries made a commitment to, for example, taking data on gun violence and disaggregating it by gender. And I will note here that in this context, gender is a binary. And that's how it's been defined in these contexts. It's something to fix, but when you look at the data, you will find it is men and women, and other options are not included. We need to fix that. But we see progress here, and the important test will be moving from those political and rhetorical commitments to action. Next slide. Why does that matter? Because it gives us a chance to move toward increased consideration of public safety and away from having the dominant interest be the property interests of gun owners. It gives us a chance to move toward prevention and away from strictly military and security focuses, toward a focus on crime, including domestic violence, and away from conflict, and toward a focus on the trade-offs that are possible between military and non-military expenditures. Last slide. What can you do? Every one of us has different interests and different strengths and different priorities. You need to find something that you're passionate about, whether it's this issue or another one. I hope it's this issue because we need more help. Find people who are already working on this or convince an existing organization to work on it. It's not clear to me that we need more organizations. We can save money and time by working with existing groups whenever possible. And health professionals, as many of you are, I believe, could, for example, push for more research and more disaggregated data on gun injuries and deaths. If you look at the data that you can access with respect to automobile safety, it is provided at so much greater depth. We have historical data back to the early 1900s on these issues because we funded that research. We need to do the same thing with gun violence, and we have nascent efforts, but they need to be expanded dramatically. And we need to be working at all of these levels because the problem exists at all of these levels. But we can't each work at all levels all the time on all aspects. So we need to pick the ones that work best for us. And looking for different kinds of allies can be really useful. Colleagues of ours in Africa, for example, found that tourism groups actually wanted to control armed violence in their countries because it was inhibiting tourism and it was causing them money. So it was costing them money. So these are long-term problems, but they're real prospects for change even in the short run, and we welcome your help. And speaking of help, I'd like to acknowledge Rebecca Peters' assistance with this presentation. I am slightly PowerPoint impaired, and I believe that takes it back to the chair to turn the mic over to her. Thank you.
Thank you very much, Natalie. That was terrific. And next up is Rebecca Peters, Senior Associate at Surviving Gun Violence. Rebecca. You're on mute, Rebecca. You're on mute. There you go.
Oh my God, yes. G'day, good morning from very early morning from Australia. Thanks for inviting me to participate in this. It's nice to see my colleagues, Philip and Natalie. We know each other and have worked together for years. Philip has given us sort of a global picture of the data, and Natalie has talked about the gender dimension, which is a super important dimension in terms of the international discussion on gun violence. I'm going to focus on another dimension, which is the survivor dimension, talking about non-fatal gun violence. I'm just going to try to straighten myself out. I see I'm not symmetrical. Oh, well. In the discussions, whether in research or policy discussions or media, there's a huge amount of interest in gun violence, but the focus is always on deaths, and that tends to be because that's the information that we have. But it's always, and so it becomes reduced to a discussion about sort of, well, where do more people die? Are the number of deaths going up and down? And by not acknowledging that a lot of gun violence, a lot of people are shot and don't die, it seems to me that we are failing to address or failing to pay attention to a huge part of the problem, and also overlooking a lot of people. I mean, gun violence occurs on a spectrum, and the difference between a homicide and a survivor might just be a question of a few millimeters in terms of the bullet, or a few minutes in terms of the trip to hospital. And so it's part of the one phenomenon, and it would be really good if we were able to look at it in a broader way. And I wanted to talk about that today. That's the focus of my work at the moment, a big focus, but also because it's something that I think is particularly relevant to the public health community. It is hard to know how many people survive gun violence. I'm going to share my screen here. Let's see. Yes, share. There we go. Because there's no data available in most countries. In rich countries like the US, there's some data available, and for example, the CDC data suggests that in the US, for every person who dies by gunshot, there are between 2 and 3 additional people who are injured seriously enough to be hospitalized. So there's been some criticism of those data, but it's basically, it's better than what we have in other countries. And in developing countries, it's even harder to measure because the hospitals in developing countries don't have resources to gather data, much less to compile it or analyze it or publish it. But the Small Arms Survey in Geneva, which Philip mentioned, in 2013 tried to make an estimate of how many people survive gun violence every year. And they, let's see, and they, am I having difficulty? Oh, there we go. And they estimated that they only could find data from 26 countries out of the almost 200 countries in the world. And on that basis, they found a ratio about 1-to-1. So for every death, they said there was another person injured, but they said that that was likely a very much an underestimate. And in their opinion, probably between 500,000, 750,000 people per year survived intentional firearm assaults outside of a war context. So they were looking only at assaults. In developing countries especially, it's very difficult to find data on gunshot injuries is mostly kept by police, and so it's very hard to find information on unintentional or in self-inflicted shootings, for example. So, and I'm working in Guatemala, which is a country very severely affected by gun violence. Homicide is the third leading cause of death in Guatemala, and gunshot is the cause of almost 40% of all injury deaths in Guatemala are by gunshot. So from the point of view of fatal gun violence, it's very severely affected. The police in Guatemala do keep some data on criminal injuries that are reported to them, and they estimate there's about 1-for-1. But that again is probably an underestimate because of the inherent problems with police data in many countries, but also in Guatemala, people have very little trust in police, and a really large proportion of crimes are not reported because people fear that the police may be in cahoots with criminals, and so they don't tend to report crimes to police. So anyway, it's a lot of people, and that's one reason why we should pay attention to non-fatal gun violence, is that a lot of people are directly affected. We've been talking about people who are shot, of course, but for each of those people, they're surrounded by family and community members who are very severely affected as well. Another reason why we should be thinking about non-fatal shooting, which is particular interest to the public health communities, if I can click this, okay, is the health consequences. Most gun violence occurs in developing countries where healthcare systems are under-resourced, not only in terms of funds, but also in terms of knowledge. So people who have to go to hospital because of being shot have health consequences, including devastating infections, irreversible problems like contractures and distortion of their limbs, organ failure, all kinds of things that that in wealthier countries don't arise nearly to this extent. And so the situation for survivors of gun violence is much worse in the world in general than we might think when we're in wealthy countries. This is Jairo. Jairo was a taxi driver, and he was shot 7 times by a group of men who stole his taxi. And he was in the hospital, and he got pressure ulcers in hospital, as many people do, and the infections that he got for them kept him sick for 8 years, and really very close to death many times. And by what he considers to be a miracle, he was saved by someone who stepped in. Jairo also, he was shot and survived, but before he was shot, his brother had been shot and killed in gang violence. And after he was shot, his sister was shot and killed by extortionists who were extorting the family. And right around the time that Jairo recovered, for all those 8 years, he was dependent on his mother to support him and various children of him and his sisters. And right around the time when he recovered from his ulcers, his mother was also murdered, shot dead. And so And that's, you know, 3 murders and 1 non-fatal shooting in one family is a lot, but it's, but I know several families in Guatemala who've had more than one person has been shot in unrelated incidents of gun violence. So it's really, it affects people. It has a very, very serious and widespread effect. Also, so, and an important thing about the health system being not so good is that sometimes people die. This is a photo of Brian and Manuel. The doctors in Guatemala say that if you get to hospital after you're shot, you're likely to survive because they'll be able to save your life. Brian, who is the young man with the sticking up hair on the left, he was shot in he was playing soccer in his street, and on the losing team, there was a disgruntled guy who was a sort of part-time gang member. He was unhappy that they lost. He pulled out his gun and he began shooting at the winning team. Brian got a spinal cord injury, and then was, for about 2 years, he also suffered with infections, and eventually he succumbed to those infections and died when he was 16 years old. And so it's, but of course that death was probably not recorded as a death from gun violence because he would have died, they would have recorded it as a death by infection. But it's possible that because of the poor quality of healthcare and the poor quality of support for other aspects of people's lives, that the rate of gun death, that the number of people who die from gunshot, that there's a sort of extended homicide, I like to think of it as, in places like Guatemala. And the impact on the health system itself is, this is a long quote, is really substantial. This is a quote from Sergio Castillo. He's the head of emergency medicine at the major hospital in Guatemala City. And basically he was just, I said to him, but what is so particular about gunshot injuries? I mean, people are injured in all kinds of ways. So why are you particularly concerned about gunshot? And he said to me, it's because of the huge numbers of injuries, of gunshot injuries that they see. But also, and this is, I imagine there are doctors and health people in the audience, would be interesting to you. He's describing the difference, how much more of a burden the gunshot injuries put on the hospital, and how much more difficult they are to survive. And of course, in a country like Guatemala and other developing countries, the resources are in short supply, resources that when you have to spend a lot of resources on one patient, that means resources that are not available for someone else. The other aspect of most gun violence being in developing countries is that that there's no social safety net, or sometimes there is, but not much. So that means there's no crime victims compensation, there's no disability support programs, there's no disability or unemployment benefits, there's no public housing. So the consequences for people whose lives are dramatically changed by gun violence are really, really severe. This is Manuel, who was the boy who was sitting with Brian in that other photo. He was also shot when he was 14. He was working as a bus driver's assistant, and an extortionist got on the bus and actually murdered the driver in front of him, and also shot Manuel. Manuel was no longer able to work. He comes from a poor family, so they lost his income, but they also lost his mother's income because he has a high level spinal cord injury, and his mother has had to give up work to care for him. So and often you see with gun violence this kind of domino effect where the person most likely to be shot is a young man, or maybe a middle-aged man. It's a husband or a brother or a son, someone who is working and bringing in an income. And when they're no longer able to work because they have been shot, often there's a rearranging of roles in the household. A mother has to go out and do additional work or has to give up work. Often a teenage cousin or sister drops out of school to care for the injured person. So there's a sort of, the economic impact on the whole family is very dramatic. And in the among the gunshot survivors that I have studied, pretty consistently, they report about a 50% reduction in household income among, because everything works on the basis of a household as a result of being shot. And of course, there's also additional costs associated with being shot in terms of health. You know, if you have to have a colostomy bag, if you have to, if you have a spinal cord injury or other mobility problem, you can't anymore take public transport because nothing's accessible and everything becomes impossibly expensive. You can't, for example, to go to a rehab appointment, if the cost of a taxi to get you there takes up most of your family's budget for the day, then you're not going to go to rehab. So there's really serious consequences beyond the initial sort of shooting. And the social consequences, developing countries are places that are completely inaccessible for people with mobility impairments. You can see Florrie in the distance there sitting in her wheelchair. I hope you can see her. She was shot by her boyfriend, who was a jealous man, when she was only 17 years old. And he said that classic line of, I would rather see you dead than, you know, have you flirt with someone else or something. Florrie is impoverished as a result of her spinal cord injury, and she lives with her relatives. That house that you can see in the background is actually it's squatted. That's squatted land on a cliff in the capital of Guatemala City. They've sort of hollowed out a platform and put a little house there, but it is incredibly steep to come up the cliff to where the street is. And as a result, Florrie only leaves home about once or twice a year. So there's a huge impact on every aspect of your life if you don't have mobility, which is a frequent consequence of gun violence. So those are all some really bad consequences which we need to know more about. I've been doing qualitative research because there's no data available, but public health, the public health community internationally could really usefully help developing countries to develop systems to be able to get a grip on not just the numbers, but also the circumstances and the nature and the consequences of non-fatal gun violence, of the trajectory of survivors and of their families. That information would be useful for developing and evaluating policies and programs, but also for advocacy. And this is, I've just whacked in this photo of Alex Galvez, who's my colleague at Transiciones, which is a wheelchair organization where I'm volunteering in Guatemala. Alex has had good support from lots of people, including the international community, and he's a well-known advocate in international circles talking about gun violence and disability. But, you know, most gun violence survivors are not in a position, their lives are so devastated by just trying to survive, that they're not able to be in the conversation about the problem and about the solutions. And in that sense, gun violence, and you see that actually even in rich countries, and in that sense, gun violence is different from some other public health issues like, you know, breast cancer. You see breast cancer survivors talking and lobbying and fundraising and all that, or HIV or whatever. The voices of gun violence survivors are very absent from the discussions nationally and internationally about the problem and the solutions. And so we need to support survivors so that they can do that advocacy. And also, we need information, because information makes advocacy much more powerful. The other, so I forgot to mention, prevention, of course, is the main preoccupation of public health people. Non-fatal gun violence is very relevant for prevention because of, number one, if you pay attention to non-fatal gun violence, you can prevent some people from dying, like Brian. Brian did not have to be a mortality statistic. And also, there are programs that use non-fatal gun violence as a point of intervention, like Cure Violence is a program that probably lots of people know in the US. It uses community members trained up as mediators to head off conflict and connect people who are at risk with services that they might need. And so survivors play a key role in those sort of preventive programs. The other thing that I wanted to mention, I suppose, thinking about because this is an American audience, I guess, largely, I think it's useful for Americans to understand the impact of gun violence beyond, of America's guns beyond America's borders. In Guatemala, the main source of guns used in crime is the US, and those are guns that are trafficked over the southern border of the US, where the gun laws are very lax. They're trafficked through Mexico to Guatemala. And also guns that are legally imported, because the US government is very enthusiastically trying to sell guns overseas. And you know, governments love to buy guns, but a lot of countries like Guatemala there have been lots of scandals where guns have gone missing from government arsenals and things like that. But also the reason why there's a lot of gun trafficking in Guatemala is because there's drug trafficking going to the US. So the US market for drugs is driving the gun violence problem in Guatemala and Central America generally. And of course, when people from Central America try to flee the intolerable situation that they have in their countries, they try to go to the US, and I just haven't really heard recognition in the US of the role that America's guns and America's drug problem are playing in the humanitarian and economic and health crisis that there is in Central America. So I think I've used up my time there. So thank you very much. Happy to do questions.
Thank you very much, Rebecca. That was terrific. I'm now going to turn over the rest of the program to my good colleague, Dr. Adnan Haider. Adnan, over to you.
Thank you very much. First of all, to all our three panelists, this is an incredible repertoire of knowledge and experience that you've all heard. Philip, your command of the statistics in terms of global gun violence it was amazing. Natalie, your descriptions of the work of the International Action Network is very powerful, and Rebecca, your advocacy for the consequences of gun violence is really shaken us to the core. So I'm very excited that we have a lot of participants, and I see now increasingly more questions coming in. And what I'd like to do is to hopefully get to as many as I can, but I might have to pick and choose, and I'll direct them to one of our three panelists to ensure that at least someone gets a response. But let me start with you, Philip. One of the things that one of our attendees is wondering is about conceptualizing gun violence as an epidemic, as opposed to some of the ways that maybe more traditionally it has been looked at. The question really is, if you view that as an quote unquote akin to a disease epidemic, as opposed to focusing on the ownership or the legal or illegality attitudes of it, does the field of public health or infectious diseases give you more tools to begin to think about it in a different way?
Thank you. Yes, definitely. In my view, the public health practice, the long established practices of public health, all the proven solutions which are being deployed on problems around the globe are very, very applicable to this epidemic. In fact, I can't see any that are even more applicable. Locking people away doesn't seem to make much difference. Changing laws and giving them threatening an extra 5 years in jail seems to make no difference at all. And yet we have this huge array, once again, I say largely invented and developed and proven by North Americans, array of interventions which we know work. For example, a very simple one, we know that teaching children to avoid poisons is largely futile, and we know that children simply can't be taught things like that, and that putting a childproof lid on an aspirin bottle is a far more sensible solution. Guns in the United States, where most of them are manufactured, the ones that we get down here anyway, guns don't even have to have a safety catch. And that's because they're largely regarded, I mean, one of the slogans in the States is that teddy bears are more regulated by federal law than guns. And one of the reasons for that is the romantic nature of firearms. They are regarded as something very, very special by our community, which doesn't want any form of intervention. That has to be overcome exactly as it was with automobiles. You may remember, if you're old enough, that the people who were blamed for the high road toll by the auto industry were, quote, the nuts behind the wheel. In other words, the drivers. They were entirely at fault, according to General Motors and Ford and so on. And this had to be reversed. It had to be shown that there were all form of interventions that could take place, all based on public health research, going from airbags and seatbelts to any number of other interventions, all the way back to moving power poles away from the edge of the street and putting them on the other side of the footpath so that they're harder to hit with a car. That sort of array, as Natalie mentioned, huge array of public health interventions are so well proven for centuries, and we could easily deploy those more than we do.
Great, thank you very much, Philip. And absolutely, I think this, and you've already indicated the transcending the principles in many cases of a public health approach. Natalie, you really spoke very strongly to gender as one variable, as a very, very important, both in terms of the input level as well as in terms of the output level. We have comments in the Q&A section about race, about multiple levels, the individual and the institutional. So in some ways, maybe we can talk a little bit about the intersectional issues, the intersectionality of the problems of gun as a global health issue. Could you comment a little bit more about that, since you've talked very, very nicely, at least about one aspect, about the intersectional issues in gun violence?
Thank you. There are direct parallels with respect to the issue of race. In this country, we have an epidemic of gun violence overall, but it is particularly acute when we are talking about people of color. We over and over again see cases in this country where people are driving while black, picnicking while black, trying to go into their own homes while black, and they find themselves arrested, assaulted, killed by police, find themselves attacked by other people, and sometimes with guns, sometimes with not, but with the police, of course, in the US, guns are always there as a threat, even if they're not used directly. And it's an incredibly important issue, particularly here in the US. And there too, I think it has to be addressed at all levels. We have a systematic societal problem with racism, and that extends from my very liberal community here in Arlington, Virginia, where if you're north of where I live, you can find a school where 1 or 2% of the students have free or reduced meals. And if you're an equal distance south of my home, you can find a school where more than 75% of the students have free or reduced lunch. That didn't happen by accident. That happened because of red lines. That happened because of zoning. And so it's an issue that is institutionalized, it's systemic, and in our community, we also have problems in that very few people working on these issues at the international level are people of color, unless they happen to be from other countries. And that is an issue we need to work on as well.
Very, very important, Natalie. Thank you so much. And maybe, let's see, depending on time, we'll come back to this issue of intersectionality, because I'm sure Philip and Rebecca might want to jump in. But Rebecca, you've really nicely outlined the impact on low and middle income countries. In your case, you were giving examples of Guatemala, which is literally one of the 5 or 6 countries which, together with Brazil, Mexico, Colombia, Venezuela, and of course the US, represent over 50% of the deaths from firearms generally in all analyses. So talk to us a little bit more about, right at the end, you talked about gun trafficking. You talked about, in some ways, what might be called the political determinants of gun violence. And I think I want to raise that terminology very carefully, as it has been used recently in the literature. And so what do you think about that as both an ebb and a flow, both for the low income country, but also for the high income country and the bilateral exchange therein? So if you could talk a little bit more about that risk.
Yes, well, of course, there's always supply and demand. And I guess it's just, you know, the countries in Central America and lots of other countries, I mean, in Africa and Asia, similar problems. The borders are not, or the borders are highly porous. And they have, you know, there's long traditions of border communities going back and forth all day. Families live on either sides of the borders. It's not as though the distinction between countries is hard and fast. And it basically becomes impossible to rely, for any one country to simply rely on policing its own border as a way to stop gun trafficking, because there's so much crossing back and forth. And also countries, many countries in the developing world have really inadequate machinery of state. You know, the police, there aren't enough police, there aren't well enough trained, they aren't equipped, they don't know how to do stuff, they don't have proper, even for tracing of guns in Guatemala, the whole business of tracing illegal guns was made possible by an NGO that provided training and found funding to be able to set up the police, the National Police of Guatemala, to be able to do gun, you know, tracing of illicit guns. So that I feel like on the one hand, it's true that you know, there's obviously a market, and the US isn't the only supplier of guns that are killing people in the global south, but it is the biggest supplier of guns, both illegal and legal, in the world, and particularly to this region. Obviously there are willing buyers available, but it feels mismatched, you know, for the US to have, for the circumstances in the US to have, you know, for whatever political reasons within the US means that the gun laws remain very permissive, and you know, I guess not much thought is given to the consequences for people who live beyond the borders, and in situations that are inherently far more dangerous anyway, because these countries are more dangerous. I guess but also obviously the influence of the gun lobby is very strong, as Philip said, on the US government recently, in terms of and Natalie, you might want to correct me here. Recently, the US government has made a move to make it easier to export weapons. So previously, export of weapons, including guns, required levels of scrutiny because they were treated as products that needed to be scrutinized before they could be exported from the US. Recently, they were shifted over to a much lower level of regulation, which makes it much easier for gun sellers to sell guns, to export guns from the US. And it just feels unfair that both the legal and the illegal you know, guns being pushed out of the US are having such a devastating impact in a region like this.
Well, thank you, Rebecca. And maybe from the global perspective. Philip, I'll come back to a little bit of a US-centric question vis-a-vis the argument that what's the conflict between the Second Amendment and the three pillars, Philip, that you enunciated, right? And I'm sure you've heard of this argument before, and I want you to react in this webinar to that, that states, individual states can determine licensing, registration, and define who can and cannot own, and therefore, what's the conflict, right? And so from your perspective, if you can talk to us a little bit more about that, and particularly if you have a sense of how perceptions of gun owners might change based on your decades of experience in this issue. Over to you, Philip.
Thank you. As you can judge by my accent, I am less equipped to talk about the Second Amendment than my American colleagues or the colleagues with American accents. And so I'd like Natalie to largely answer that Second Amendment, or Rebecca, that Second Amendment question in more detail. But it is a matter of great perplexity outside the borders of the United States as to why the Second Amendment is taken the way it is. And by that I mean that even the most recent Heller decision in the Supreme Court left the states absolutely capable, absolutely entitled to regulate in their own way and to make legislation which suited their circumstances. It is not in any way such a guarantee for gun ownership as many gun owners would have you believe. And there is, as one former Supreme Court justice said, it is, I won't try and get the words exactly right, but he said it is the biggest fraud, I repeat, fraud, ever perpetrated on the American public, that the Second Amendment guarantees as much as some people claim it guarantees. But I would like to get back to the subject of race, and I'll do that after my colleagues have answered your question.
Yeah. So Natalie, would you like to come in on the same aspect, please? You might be on mute, Natalie. Just make sure.
Of course I was. Sorry.
Thank you.
My students get to remind me of this from time to time as well. It's new technology. In terms of the Second Amendment, I agree completely with Philip. The states have the ability to set guidelines, restrictions, requirements at many different levels with respect to access to guns and use. The state of Virginia, Commonwealth of Virginia, having recently changed control of our legislature, has actually passed a number of good pieces of legislation that actually provide common sense gun violence prevention measures. Many of them are simply trying to get back to the level that we were at before the legislature shifted over into Republican hands. But for example, Virginia had a restriction that said people could only buy one gun a month. I remember the first time I discussed this at an international gathering, people thought I was making a joke because that still seemed so excessive. And yet in the US context, that was the kind of provision that kept people from making purchases of dozens of guns as straw purchasers, buying them for someone else who wasn't allowed to purchase guns legally, or in order to export them to places that had stricter gun regulations. So one aspect of this is action at the state level. And I saw there was a question in the chat with respect to states getting together to develop common policies. I think that would be a highly productive way to go. And we're seeing more and more of that sort of work right now in the responses to the coronavirus, where we see groups of states recognizing that their fates are intertwined and the health and safety of their citizens are intertwined. So the District of Columbia, Maryland, and Virginia are working together, for example. New York is working with a number of the states in its immediate vicinity, because just as Rebecca was talking about borders being porous on a national basis, they're also porous on a state basis. I cross the river that's a few miles from my house, and in one direction I'm in DC, and in the other direction I'm in Maryland. So you really can't afford to have independent standards. I think having those joint standards is a way to go. At the same time, though, I think that regional and state standards are a weaker substitute for the national standards and the national measures that we should have. There is no reason from a substantive perspective that we shouldn't have gun safety laws that affect the entire nation. I remember being on a radio show years ago where, a man was talking about how, he kept his weapons safe from his kids, but that they were locked and loaded. And I said, when you were growing up, did you know where your parents kept the key to the liquor cabinet? Because if you did, then the chances are pretty good that your kids know where you're keeping the key to the gun cabinet. And so it's a question of separating the weapons and the ammunition, preferably not having them in the home at all, of course. And eventually getting to the point where we can set national common sense standards rather than leaving it to the states to do it. That's the better way to go from my perspective.
Well, let's go back to Philip.
Sorry, go ahead.
Rebecca, hang on. I think Philip just wanted to finish his comment and come back to, I think, a comment on race and intersectionality, and then I'll come back to you, Rebecca.
Thank you. I have not just the privilege, but the obligation, I think, as an outsider, to be a bit less diplomatic than Natalie. To us, the rest of the world, we largely see the American gun problem as being driven by fear of race, driven by the racial problems that America has, and the fear of entitled white males who fear that they're being disenfranchised, even emasculated by suggestions of sensible gun control. Now, we see this in all sorts of fields. We see it in the most professional and moneyed up lobby pushing the idea of racism, racial fear, fear of others, fear of people of a different color, and that is right through the National Rifle Association, gun lobbies, advertising, and their horrible photos of women in car parks waiting to be raped because they haven't got guns in their purses. And this is largely, it's very similar to the stranger danger mythology of rape. That is by far the least likely type of gun violence to beset an individual in the United States. In fact, the statistics show that the more guns you have in your home, the less safe you are, and that the person most likely to be injured by a gun is the person most likely to injure you with a gun is a person who already has a key to your door. In other words, a person in your own household, be it from suicide, from unintentional shootings, or from domestic violence. Now, all of that comes down to race and gender, and it is extraordinarily important to take into account these dimensions.
Thank you very much, Philip. And you're absolutely right. Sometimes it does take an external eye to make us realize about internal issues. But Rebecca, thank you for waiting. I wanted to jump into this particular issue.
Yes, I wanted to, in relation to Natalie's comment, am I on mute? Oh no, okay.
You're fine.
To say that in Australia, one of the important points of our reform was to get national uniform gun laws across the country. We have different states and territories in Australia, not 50, luckily for people who are working on law reform, but we did have a patchwork of different laws before. And there was a particular a massacre that occurred in 96, which was sort of a tipping point for us, in which people from every jurisdiction in Australia were injured or killed. And it really highlighted the fact that you could live, we did have some states in Australia where the gun laws were much stronger, but those people also go on holidays to other places. And it really highlighted the fact that it makes no sense at all to have different rules in adjacent jurisdictions or within one country, and also that the part of the changes to the laws meant that the police were able to generally refurbish their systems so that they're able to work together much better on other police actions as well. So there were benefits from the reforms there. I saw a question also in the chat about how we funded the buyback. We had a buyback of semi-automatic weapons after that as part of the reforms, and that reform was funded by a tiny percentage increase in the amount of tax that we paid for our health system, and it ran for exactly 1 year. And after a year, everyone got a letter saying your tax has just gone down by this tiny proportion, and the amount that the buyback cost is estimated to have been repaid in the costs of violence avoided 20 times or something like that. So.
Great, thank you. Thank you. I think it'll behoove us to at least touch upon COVID-19 because, we are in the middle of a pandemic. In some countries it is past, in others it's still passing, and in all countries it's still present in some way, shape or form. So I'd like each one of you to reflect a little bit on how COVID-19 vis-a-vis either prevention or outcomes or consequences are being affected by COVID-19. So Rebecca, since you're already unmuted, maybe we go in the reverse order, so to speak. Go ahead and if you commit yourself to just a couple of minutes, because I've got less than 10 minutes to finish.
Oh, yes. So, well, I think all around the world, we've been appalled to see the fact that in the US, as so often happens, something bad happens and Americans rush to get more firepower, thereby raising the danger level in their community. There also has been a move to do that in Australia and New Zealand, but the laws in Australia and New Zealand mean that it's not possible to just walk in, buy a gun and walk out. I mean, the mechanisms that we have in place are, they mitigate against that. But I guess I'm particularly concerned about domestic violence, and as people are stuck at home with partners who are abusive, or and that was my original interest in this issue, actually related to violence against women, and also the issue of the possibility, the fact that in countries like Guatemala, where the COVID crisis has caused just a catastrophe in terms of in terms of people's incomes, people are getting desperate, and I'm concerned about the possibility of crime surging up because of the lack of economic support in poor countries.
No, thank you very much. Both, several of those points, the domestic violence point, the crime point. Natalie, over to you from your perspective. What are the intersections there?
I agree with respect to the risks. We've already seen someone being killed in a fight over whether they had to wear a mask and killed. This is a situation where in another country that might have been a fist fight. And in this country, it was a fatality. And we should not accept that as a factor in everyday life. On the positive side, I think we inevitably see an increase in the public health focus as a result of COVID-19. But a positive aspect of that is we're seeing health officials, public health officials, as public authorities. And I believe that may actually improve their ability to also be heard and seen on other important issues of public health, such as gun violence. We've had a fight in this country over whether physicians are even allowed to talk with their families and their patients, pediatric with kids, about the risks of guns in the home. I also wanted to follow up quickly on Philip's point with respect to race. Absolutely. Guns are being sold on fear. on fear of the other, on fear of government. And yes, when you look at these pictures, it is generally white males who are concerned about their place, who've been told that, you know, these things have been taken from them by women, by people of color, and the anger is extraordinary, and it is very, very dangerous, because again, that anger with fists produces bruises and perhaps a broken bone. That anger with a gun produces deaths. Someone raised the question of suicide in the United States, which is responsible for a majority of the gun deaths. Suicide attempts by guns are using guns are almost always successful, fatal. Suicide attempts using anything else normally are not. And that's the difference in this country.
Great, thank you very much. Philip, over to you from your perspective, the COVID-19 situation.
Okay, well, my perspective is a broad one, in that for the past couple of years, I've been installing firearm registries, weapon counting mechanisms with police forces and customs agencies and militaries around the world. And I've been speaking in countries like Samoa and Papua New Guinea, where they have a real problem with firearms, and Fiji, the military there. But also in earlier this year, I was in Nigeria talking to the Economic Community of West African States, 15 countries who all want to install firearm registries because they don't want to go down the American path, as they call it, with guns. Also in Somalia, Mogadishu, we installed a firearm registry there. Now, if those countries can do it, certainly, surely, America can do it. The fear amongst all of those countries is that this pandemic will hit them harder than anybody else. The underdeveloped countries of the world, not allowed to call them that anymore, but these are the nations who are most threatened by this, who will suffer the worst, in all the way from domestic violence to gang violence to, in Italy, we see the mafia has become the protector of the public in terms of COVID-19. And it is an opportunity for arms traffickers, for those who want to generate violence, those who want to stoke fear, those who want to grab an unfair share of resources simply because they have a firearm. This is going, in most of these countries, this is seen as the next threat. They're thinking straight away, not just of climate change, which is going to hurt everybody, but they're thinking of the effect, even coming out of COVID-19, of increased gun violence. And this is going to be a serious problem in a lot of these countries. It's going to be the only way that some people see of getting what they see as their fair share of resources, and even getting hold of a vaccine, for example. If for some reason it's rationed and held back from countries, there's going to be all hell is going to break loose. And I don't want to be pessimistic about it, but I see that as the next major challenge.
Thank you very much, Philip. Thank you, Natalie and Rebecca. I'm going to start winding down and hand over to Sandra in 1 minute. I just want to reflect that on the one hand, we've covered such an amazing array of topics, and yet we actually have not had the time to talk about in detail, Natalie, about the suicide impact of gun violence. We haven't really talked about the role of the private sector and the role of businesses to look at issues from the views of the market. How does the market operate? But I do think that what we have reconfirmed is that gun violence does affect pretty much every country of the world. There are some countries with a lot of the problem, but it is disproportionately affecting some people compared to others, whether you define that by income or by race, that it translates and migrates across countries and national boundaries, just like an infectious disease does. And so there is no reason why we ought not to consider it a global public health issue and potentially a global public health epidemic. And I think that's partly the value added of this webinar, where we want to transcend the conversation just as a US domestic issue into a global issue. I want to thank all three panelists for their participation, and also my colleagues at the George Washington University Milken Institute School of Public Health who made this possible, and our great collaboration with Boston University School of Public Health, and hand over to Dean Sandro Galea, maybe to make a final comment and end our webinar. Over to you, Sandro.
Thank you very much, Adnan. I actually have very little to add. I thought your summary was perfect. Perhaps I was most struck in hearing Philip, Natalie, and Rebecca's talks about how important this issue is and how relatively little attention we pay to it. It's actually hard to think of another issue of such consequence, if one measures consequence and moment by morbidity or mortality, where there is as little attention paid to it. In the US, there's been some data recently showing how gun violence is disproportionately, usually with something like drowning, that we pay much less attention to than the burden of disease. And when you look at it globally, it's exactly the same. It's exactly the same problem. And so I thought this conversation was outstanding, and it was a really excellent way of starting to draw attention to it. But it really is just a drop in the ocean of attention we should be paying to this issue. So I'm really grateful to you all for having this conversation. I'm grateful to the audience for outstanding questions, and to my colleague, Dr. Hyder, who I thought did a fantastic job of helping capture all this and move us forward together. I very much hope that this is just one conversation among many, and that it creates, it at least contributes to catalyzing momentum on more scholarship and more action on this issue. Again, thank you to our panelists, thank you to our collaborators on this, and thank you to everybody in the audience who joined us. Everybody, stay safe, stay well. Have a good afternoon, evening, or day.
Thanks, that was fun.
Yes. Okay.